most autoimmune disorders tend to affect women more than men.
Okay.
We don't know really why exactly. Maybe it's hormones, maybe it's not, but it does tend to affect women more than men. And in multiple sclerosis, 2/3 of the people affected are women. There's about 2.9 million people worldwide with MS. We used to say, and around 66% of them are women, and a third are men.
So we tried to kind of
all these tests.
I retired and obviously, but thankfully,
All right, we're so lucky. So lucky. We're back with Dr. Ahmed Shatila, who's a neurology consultant at Sheikh Shakhbout Medical City. And today we are going to talk about a topic that you are especially passionate about.
Definitely. It's nice to be with you yet again. I mean, the first time was so much fun. And when you told me that you want to do another podcast on a subject that I am truly passionate about, I'm like, let's do this.
All right. So without further ado, that subject is multiple sclerosis.
Exactly.
So I know that a lot of people hear the terminology and they know of it, but they don't actually know what the disease is. Is it a disease?
It's been around almost from the days of Ibn Sina.
Okay.
I mean, back then we didn't have a name for MS, but if you go back to the original articles to Ibn Sina, he described people who had symptoms with what we know now would have been MS.
Okay.
It wasn't really until like the mid-1800s that a doctor called Charcot coined or termed a pattern of symptoms in women, and he called it une plaque de sclérotique. Okay. I'm bad with French, so
but that was really good.
That's my best French you're going to get today, which I guess is sclerotic plaques, multiple sclerosis. So you get multiple plaques. So it's been since then described as such.
Okay.
And it is a disease, and we know now, we have an idea of what's causing it. We have a very good idea of who tends to get it, what are the symptoms like, and we are developing treatments, and the treatments are getting better and better every day.
Okay, and so there are two things that I actually want to ask as a follow-up. You mentioned women at the beginning. Is it like predominantly found in women, and is that why that they first found it in women? And secondly, what are the symptoms?
So multiple sclerosis is an autoimmune disorder.
Okay.
Now, autoimmune, there's a bunch of disorders that fall under that umbrella. It basically means your body's attacking itself.
Right.
Now, diabetes type 1, juvenile diabetes, it's autoimmune. Rheumatoid arthritis, autoimmune. Lupus, autoimmune.
Yes.
Multiple sclerosis, yet autoimmune. Now, different disorders, but with multiple sclerosis, your body's attacking a fatty substance called myelin.
Okay.
Myelin, if you want to really think about it, if you imagine your brain as billions and billions of telephone wires connecting one area to the next, the insulation of those telephone wires is myelin.
Okay.
So for some reason, we don't know why, your body starts stripping away the insulation of these nerves. And if you ever get two wires and you put them together, you get a short, right?
Absolutely.
Bad communication. You can actually get breakage in the communication. And that's exactly what happens in multiple sclerosis. So now, depending on where the breakage or the inflammation occurs, that's where your symptoms will occur.
Okay.
Now, if it happens in your optic nerve or the nerve in your eye, you can lose your vision. If it happens in, let's say, in your spinal cord, you may become weak or paralyzed. If it happens in the cerebellum or the area that's responsible for balance, you can lose balance. So really, it's depending on where the symptom or where the lesion is, that's what your symptom's going to be.
Okay.
And one of the biggest problems with MS, there is no predictive pattern.
I was just going to ask.
You cannot. So when you ask what are the typical symptoms, it depends. Everyone has different symptoms. And that's what makes this disorder so complicating, because you may have one set of symptoms, your friend a completely different set.
Right.
One person's disease could be very mild. Another person may have had the disease only for a couple of years, and they could be in a wheelchair.
Okay.
You cannot predict who's going to get what and when it's going to happen.
Right.
Now, if we look at who gets it, young, productive women. That
Oh.
is, most autoimmune disorders tend to affect women more than men.
Okay.
We don't know really why exactly. Maybe it's hormones, maybe it's not, but it does tend to affect women more than men. And in multiple sclerosis, 2/3 of the people affected are women. There's about 2.9 million people worldwide with MS. We used to say, and around 66% of them are women, and a third are men. And in the UAE, it falls around the same pattern. And if you look at the age group, young reproductive women, 20 to 40s.
Wow.
And I think now I'm going to take a step back, young reproductive people. Because if you take a step back, it's the time in your life when you are just starting your life. You're graduated from university, you may have just got a job, you may have gotten married. You're planning your whole future ahead of you, and then you get this illness. And the problem with the illness is nobody knows what it's going to look like in 5-10 years. Nobody knows what your symptoms will be in 5 to 10 years. And nobody knows how you'll look like. So there's a lot of uncertainty and I guess a lot of question marks, which can make it very scary for a young person.
Absolutely. I mean, I was just about to ask you, like, what kind of preventative measures or how can you predict what's to come? And you were just saying that it's not one of those disorders that you can just, anticipate what's to come and treat it right then and there.
No.
Yeah, which brings me to my next question then. Is there a cure? And you mentioned treatment, so I'm assuming there isn't an absolute cure, but what does the treatment plan entail?
So, first of all, we don't really know why people get it.
Okay.
And when I mean we don't know why people get it, we have ideas. We kind of know what's going on. But again, it's not 100%. We know that your body is, for some reason, it's attacking itself.
Right.
But why, we don't know why. Now, we think genetics play a role. We think environment plays a role. Maybe childhood obesity plays a role. Certain infections may play a role that you may have gotten when you were a kid or when you were younger that kind of started the cascade. But then when it gets very confusing, like we'll focus on a couple things like vitamin D.
Okay.
Vitamin D, studies have shown that vitamin D, people with MS at the time of diagnosis tend to have low vitamin D.
Okay.
And vitamin D does play a role in inflammation. But when we look into UAE, almost everyone in the UAE is vitamin D deficient.
Yeah.
But not everyone has MS. There's only around 1,500 to 2,000 people in this country of 10 million.
Okay.
So we know then, but 90% of my patients have a low vitamin D.
Okay.
So it's just one part of a bigger puzzle. Infection. Another theory is that infection, most commonly EBV, it's the virus that causes mono, the kissing disease, when you're younger.
Good.
So around 90% of the population has developed mono at some point in their life. But not 90% of the population has MS. But 100% of the MS population has mono.
Okay.
So you see, that's yet another puzzle or another piece. So when twins, if you have MS, your identical twin only has a 25% chance of getting MS. And that is a
interesting.
person that is copy-paste you, right?
Right.
Nobody can be closer to you than your identical twin.
Right.
But yet he only has a 25% chance. So there are many pieces, but I don't think any one answer. So we look at it all together.
Right.
So
More of a holistic approach.
so going into that, we can't prevent it.
Okay.
because we don't really know what exactly is causing it. There is no MS vaccine, or if you follow a certain lifestyle, you won't get MS.
Right.
But once you're diagnosed with MS, there are certain things we can do to try to mitigate or reduce the rate of disability progression.
Right.
And the way we try to do this is threefold. We have medicine to reduce the inflammation. By reducing the inflammation, you're causing less attacks to the myelin, right?
Okay.
You're causing less symptoms, less disconnections, which can cause less disability. And studies have shown that the medicines have gotten very good. Like 25 years ago, when we first had treatment, they were around 30% effective
Okay.
at reducing disability or reducing attacks. We are now talking 90%.
Wow.
So we've come a long ways.
Yeah.
And medicines have also been shown to potentially improve quality of life. Because if you have less disability, you're more likely to be more happy, if you want to say, right? You know, they've done studies where they've looked at people with MS and they track the quality of life based on your disability. The more disabled you are, the less quality of life you would have. So if you can try to prevent that or reduce that, it actually will inevitably lead to more happier, satisfied people who feel like they're stable. That's one aspect. The second aspect is physiotherapy, rehab. Extremely important. Again, so we've got the disease tongue twister. Disease management, physical and occupational rehab, strengthen what you already have. And then the third aspect or the third arm is symptom management. The symptom management is try to reduce what symptoms are bothering you. Like some people with MS may have difficulty with bladder, problems with bladder. It can be embarrassing. It's very treatable. But they need to talk about it so that we can address it.
Right.
They may have pain. We can't make the pain go away, but we can try to reduce the pain. And that falls under symptom management. We don't yet have a medicine that repairs. We have the damage, we have things that can stop the inflammation, but we don't yet have a medicine that actually causes repair.
Okay.
There's studies, we're always optimistic, we always will stay optimistic and hopeful, but we're not there yet.
Okay. So there's a lot of passion when you talk about MS, and I know that it springs out of a personal experience. And I want to go into that a little more, if you don't mind.
Definitely.
So when did you find out you had MS, and how did you react?
I was a first-year medical student. And I remember it was like, in medical school, it was around Christmas break. Right before we were going to get out for the New Year's, I had a biochem exam, and I'm studying in the library at midnight, and I'm just sitting, and I turned to the left. I remember like yesterday, turned to the left to see what time it is, and I saw 2 clocks. 2 clocks, and I shake my head, and I'm like, oh, that's weird. And it went back to normal, so I'm like, oh, I'm tired, I'm not feeling good. And then I continued my night, slept, took the exam. The next day, I woke up. Now I'm seeing double for real. And that started a series of what's going on, why am I feeling like this? And I went to multiple doctors to hear multiple different reasons, from you're dying from a brain tumor to, oh, this is nothing serious. We'll see you in clinic in 2 weeks because it's New Year's. Not a lot of people are open.
Right.
But in the back of your mind, you're like, I can't just, you just told me I'm going to die.
Yeah.
I need answers.
Right.
And so it was a very scary time for me. There was a lot of uncertainty because the internet back in 2001,
Okay.
we didn't have a lot of information. It's not like today, right? And even back then, you still couldn't trust back then what Not everything on the net you could trust, just like now.
Obviously.
So it was hard. You don't know where to go, what to refer, and what does it mean. And then finally, I get told, you know what, you got MS. And after getting diagnosed, I was like a lot of the people I take care of. And not just MS, people with MS, people that are faced with grief. I always say that we always go through 5 stages when we're under grief or when we get bad news. The first one's the denial. It's not real. It's not me. Doctor made a mistake. Second one's the anger. Why me?
Right.
What did I do? Why not him? Why not them? I'm a good guy. Bargaining. I'll do this if my disease. We start bargaining. We start trying to find reconciliation that maybe if I change, things will be better.
Right.
Then you get depressed when none of it works. But finally, we all accept. And that's not about MS, it's just the 5 stages of grief. And so I always tell my patients, what stage are you in? And they always look at me like, what do you mean? It's a simple question. What stage are you in? Because for me, it took me many years to finally come up to that term where I finally accept it. I was open to talk about it. I was never really one thing or next. I would circle between the anger, the denial to prove that there's nothing wrong with me. Not to me, but to the people around me. I'm fine, just like you.
Yeah.
But then I'd realize, no, I'm not fine, I'm sick.
Right.
Then I'd get depressed about it. Then I'd get angry. And I kept circling in that. And I remember, I don't remember when, but it was maybe like around 8 years ago. So I struggled a long time. I've been diagnosed since 2001. So almost, 23 years? It took me around 15 years. You're struggling and you go through these highs and lows or just trying to figure out what's going on.
Right.
And then finally I asked myself, instead of why me, why not me?
Yeah.
Why not me? And once I asked that question, I just found peace. And it was always, and then I look back, it was always the patients. My friends helped, my family, they were a great backbone. I cannot deny them. My wife and kids, everyone helped in their own way. But when I really look at it, like what helped me, it were the people I cared for, just like I helped them the way they helped me.
Right.
And I always tell them, like, we're helping each other out. تعكز عليك اللي تعكز عليه. We support each other. And it was that motivation, or it was those stories that finally made me realize, no, this isn't a curse. It's not about good or bad. It's not about punishment. It just happens.
Yeah.
And the question was, well, now that it happened, what are you going to do about it?
Absolutely.
And I knew all of these things in my mind. But it's hard to convince yourself. Sometimes you'll say things and you believe it.
Of course.
But do you follow what you believe? It's always hard. Like,
it's easier said than done.
And that's why it was a struggle. But was it 10 years of 20 years of anger? No.
Yeah.
It was. You get these ups and downs. You're happy. You're sad. You get reminded, and then you go back to normal. But it wasn't. It was around 8 to 10 years ago where I finally completely accepted that, no, this is okay. I'm not afraid.
Yeah.
I'm not embarrassed. You know what? I'm in a wheelchair. It's okay. And I use that as a point of strength. I would go to my patients. So I'm in a wheelchair. It's all right. Well, I mean, if I'm okay with that, I hope you don't end up in a wheelchair, but life doesn't stop just because you may need a cane or a wheelchair.
Absolutely.
And that's the message I always try to tell people, is that I always like looking at this life like a movie. Just because you get one bad clip doesn't mean the ending's going to be bad. It's, you know, if I look back, it's everything that has happened. If I look back now, it's because of MS. I mean, I now care for one of the largest MS clinics in the country. I've been the source of inspiration to so many people.
Yes.
I helped establish a national MS society. I was a recipient of the Abu Dhabi Award. There are so many positive things that came out from what I thought was a very negative thing. I think I'm a nice guy. I would still.
You are.
I would say that I would be a nice guy had it not been MS, but it was that one thing that mobilized me or let me put my energy and my energy and my focus on this one issue
Yes.
instead of getting distracted. So you don't know how. I always tell people, you don't know where you're going to end up.
Right.
Take it day by day.
And the difference you're going to make. Because to me, Dr. Ahmed, you are the beacon of hope for people who might come in, you know, with an early diagnosis of MS and they honestly don't know what to expect. And when you were talking, it clicked in my head because I have a friend that was recently diagnosed with lupus, and she is going through such a tough time because I think the major aspect is the psychological aspect is I don't want people to look at me with sympathy. She just doesn't want that.
Yeah.
And that was the most painful thing about her diagnosis. She's like, I know I'll get through it. It's just I don't want that. I want to feel like I'm okay. I'm quote unquote normal.
Yeah.
But what is normal? I mean, when you think about it. And honestly, I think the key takeaway from your story is finding the opportunity in the hardship.
And I think, you know, with age comes wisdom, you know.
Yeah.
If I could go back to, I mean, I am definitely a lot older than I was 21-ish when I was diagnosed. Younger, I never knew what MS was, don't know anyone who was sick around me per se with a chronic illness.
Right.
You know, I was blessed with healthy family and friends, which I wasn't exposed to that. So knowing what MS was or being in a chronic illness was a slap in the face. I didn't know what to make of it. And there's a lot of uncertainty. Like your doctor says, you may be disabled, you may not. I don't know. You may die early, you may not. I don't know. You may be in a wheelchair, you may not. Okay, there's a lot of maybes here.
Absolutely.
And society, I think, unfortunately, society views people in disability as somehow lesser people. And I don't mean that. We've come a long ways. But we're not lesser people. We function just like everyone else.
Absolutely.
We don't need pity. We need empathy. And a lot of times people may say, oh, you're disabled. It's all right. I'm in a wheelchair. That's fine. I'm totally okay with that. I don't need pity. I don't need you to feel sad for me. And that's what I mean, that people may view me that I'm not good enough or you're disabled. And I think it doesn't mean that they're bad. They may think they're doing what they care about.
Yeah.
But it's that negative image in their mind, or I can't think of the right word. Help me out here.
Maybe that they view people with disability as helpless. I mean,
Yeah.
not a matter of less than them, but just that they're helpless when in actuality you're doing so much more than an average person. I mean,
Better said. Yes.
Yeah.
Thank you. Helpless. I think that's really what it comes that you can't do what you do without help. We need to help you. Or we need to support you to get your underway. I always like the joke like, I can do just like you do.
yeah.
But also, if I get tired, I also need you to understand that maybe there are things I can do. And if I get tired, hey, I get tired. It's okay.
Mm-hmm. Absolutely.
So awareness is key.
Mm-hmm.